Good morning. My name is Kim Martinez. I'm a registered nurse and I'm the nursing education coordinator for this facility. Today we're going to talk about understanding stroke. As newly graduated bachelor's prepared nurses that is probably under 30 years old, I would guess that you don't spend a lot of time thinking in depth about stroke. However, as a newly graduated nurse at an inpatient rehabilitation hospital like this is a diagnosis that you'll spend a lot of time with. Our objectives today are that we will define two different types of stroke, the expected deficits based on the location of the stroke, and describe mobility implications for a patient with Pusher syndrome. And we'll talk more about that in just a bit. We're going to meet these objectives in a variety of ways. First, we'll have the didactic talking about the different types of stroke, and we're going to get into groups and talk about how it happens so we can better educate our patients. We want them to understand how they got here, now they're here, what's next, and understanding the different types of stroke will help us with that. Then we're going to work on case studies that help us understand the location of the injury is responsible for different deficits. And the clinical team working together is really important in optimizing the recovery from stroke. And then the return demonstration skills component is going to be important for our pusher patients. These patients, of course, are post-stroke. They've got a weak side or neglect on one side. And because of that, they feel that their center of gravity is off by 18 degrees. So for while you and I, this is center for these patients. And when we push them upright to our center, it throws them off balance and they end up pushing against us. Thus the term pusher patient. They're trying to get back to their center of gravity. We'll evaluate our outcomes and our objectives to see how well we did by having our didactic. And after this is over, at the end of the day, there'll be some online learning modules that you'll work through. The second part is the case studies being presented, and I'm kind of excited about this. You're going to work in groups, and I will give you a case study that either identifies the location of a stroke, and in your group you will be talking about what the expected deficits will be and what the treatment plan is for that. Or you'll be presented case studies with a deficit, and based on that deficit, you're going to figure out where the location of the injury is, and of course work out a treatment plan from that. Using our brains is really important, but we need more than that. So then we'll be doing the return demonstration on the mobility stuff. But I think the most important part of this session is working in a team manner. Team approach in stroke recovery is critical. As nurses, we have a due diligence. It's important for us to monitor our patients' vital signs, to provide them with their medications, to help them with their direct care, do the things that we do as nurses, educate our patients. That's our primary thing, right? But we also have to understand what the other teams do. Physical therapy, they get the patients back into mobility, assess their gait, get them back on their feet, and if not, how are we going to get them around? They have to go back home, right? Occupational therapy, that team works with them on their ADLs. How are they going to shower? How are they going to navigate different things like that, their personal care? And then speech therapy, they work on making sure they can swallow safely, to work on their cognition and their memory. So in this level of care, we do not work in silos, nursing, PT, OT, speech. We work in very much an interdisciplinary fashion. So when we talk about stroke, the first thing we'll discuss in the didactic is the two different types of stroke. The first one is ischemic, and that's what we see most often. That type of stroke is caused by some sort of blockage of blood to the brain, an embolus or thrombus of some sort. The hemorrhagic, that is where the vessel is burst and there's bleeding to the brain. It can be in the subarachnoid space or the intracerebral space, but all the bleeding is causing pressure on the brain, just causing the injury through that. Sometimes that's just caused by things as simple as hypertension, chronic hypertension. And imagine if we could prevent that by just educating our patients well. But we also have to understand how important the location of the injury is. We have two different sides, right? We have two different hemispheres. We have left side and right side. Our right side is responsible for our creativity, but it's also responsible for recognizing objects, names, faces, objects. That's called agnosia. It's responsible for recalling names and attention span. These are our really impulsive patients. They feel like they can do whatever they need to do without really that stop to be reasoning. The left-sided patients, that's our logical patient. That's the logical side. They're very slow, methodical. This is also where our language processing happens. Our speech and language processing occurs in this side. But not only the hemispheres, but we have our different lobes that are really important to understand. Each lobe has a specific job. The frontal lobe, that's responsible for our executive functioning and our planning. The occipital lobe, that's for our visual processing. The parietal lobe, it has its specific job of processing sensory input. So each lobe has a very specific job that we have to understand. I want our patients, and I want you to understand how important educating our patients on risk factors are. There are some risk factors that we have zero control over. We can't control age. We can't control ethnicity. We can't control our genetics. Those are things that may predispose us for stroke, but we have zero control over. But the modifiable risk factors, those are things that the patients absolutely have some control over. Obesity, physical inactivity, smoking, diabetes, illicit drug use, alcohol abuse. Those are things that patients do have an amount of control over, that if it's handled properly and if they don't engage in those type of things, then they may prevent stroke initially or prevent the reoccurrence of stroke. So if we can just really teach our patients on how to prevent stroke with these modifiable risk factors, we'll make a big difference in them, I think. I expect that you're going to have some questions throughout the day. You may want to know if there's more. Is it possible for more than one area of the brain to be affected? You may want to know if you can pinpoint the location of the injury based on their deficits and their dysfunction. Sure you can. Maybe you'll want to know what the gold standard is at identifying the location of the stroke. And what education do we need to provide our patients? Those are really important questions that we'll be covering today in addition to our objectives. We follow the American Heart Association and the American Stroke Association clinical practice guidelines. They're the people that guide our practice with these patients. So if you don't have any further questions, are you ready to get started? All right, thank you.